Welcome back, guys. We have another Will Chat for you. This week, what are we going to discuss?
Plantar fascia.
You just like saying it like that. Say it like that again.
I do. Plantar fascia.
Fascia.
Plantar fasciitis. It's fancy.
All right, so we talked a little bit about fascia.
Yeah. Fascia.
Last week when we discussed dry needling, and we gave you just kind of a little thought on what it was. I kind of described to you the knot and how getting that out of the clothes.
And
but
a
we
spider
also,
web.
Yeah, talked about a spider web, and you were saying something about a spider web. It was pretty cool, about how our fascia, what does our fascia do?
Our fascia is connective tissue, and it wraps around the vessels, around the muscle. Each little piece of us is wrapped in connective tissue so that it holds us really stable and still.
So we need it.
Yeah.
It's not something that, so when we say we're dry needling fascia, it's not that we're trying to get rid of the fascia.
No.
We need it. Sometimes the fascia just gets wrapped up too much.
Just like a spider needs what's in the spider web. And so the spider web kind of keeps it all together so that the spider can get the nourishment from that
And engulfs
food.
it.
Yeah, it engulfs it. And so when we have an injury or we're hurting from something, then our fascia is trying to hold us in a position so that it can still get nourishment somehow.
Especially if we've had like a muscle tear, because it kind of holds everything kind of together. So we want to keep our fascia together. But when we have a lot of people know this, but if you add itis onto the end of a word, it just means inflammation. So when we say fasciitis, plantar fasciitis, what we're talking about today, it's just inflammation of the fascia.
Yeah.
And I have this back here, and I know you can't really tell, but you're going to see a video or a picture here in just a second of what fascia looks like.
So here you can see the spiderweb effect of the fascia. This covers all parts of our body. Okay, so now that we've looked at a picture of the fascia, let's talk about
Symptoms?
Yeah, symptoms that people have, maybe that point at them dealing with pain in the feet.
Yeah, not pain in there, but pain in your feet.
Yeah, but pain in your feet.
Yeah. All right, so let's talk about some of the symptoms. So we're saying this out there so that if you guys are kind of dealing, and I want to say the word suffering because again, that brings us back to kind of what our mission is about suffering. If you suffer from some of these symptoms, then it may be plantar fasciitis, it may not. We're not trying to diagnose this, but we're just going to kind of give you some general exercises you can do if some of these symptoms are things that you might have. So what are they?
So do you have pain in your feet, especially when you're walking or standing too long?
That was kind of the yesterday, we're going to talk about the question that was asked. That was the number one thing that she was dealing with.
Standing too long. How about a burning feeling in your feet that's like stretching or pulling in the arch of your foot?
And I brought our handy dandy foot here so that you can kind of see. You've got your natural arch, okay, that hits the floor, and I'm trying to show you what it looks like from the middle, okay? So here's our ankle, and your fascia is going to line that arch right here. It's going to line that arch, okay? And so when it's taut, it's actually pulling anytime you do any kind of where you're pushing off whenever you walk, or even if you kind of pull up like this as you're pulling your foot through, then it's going to make that stretch out. And so you might feel that pain every single time.
Yes, exactly. Some of you might have been walkers, but you can't walk or run a mile because your feet hurt too bad.
A lot of runners deal with this issue. Plantar fasciitis seems to be something, as well as the IT bands, that runners, especially if you're a new runner, kind of deal with.
Right.
Because it gets really taut.
I know my family likes to go hiking, and sometimes it's how we feel that morning when we get up. Can I go and hike with the family? Can I do recreational things, or am I limited because I've got pain in my feet? And I do have a lot of friends that tell me I can't do that because my feet hurt.
So we had, the reason why we're even bringing this up today is we had a great email. We told you ask us questions because we want to give some general thoughts and ideas out there that could help with some things. So we had a great question, and this question comes from Taylor, and I'm going to read it out loud to you so that you have an idea of what she asked. She said, I saw your video on dry needling. I've heard that it can be an alternative for plantar fasciitis pain, and I was wondering about it. I have several family members with plantar fasciitis, including my mom and I. Even though I have it, the pain started at a younger age for me than my mom. I've been struggling with it since early high school, and it didn't start affecting my mom until her late 20s. So she's been dealing with this for some time. On top of that, her mom had tried corticosteroid injections, and she also did some pain medication, and neither one of them really worked for her. And so she kind of reported that back to Taylor, that, hey, these things didn't work for her. She did invest in some really good heel supports, and that did seem to give her a little bit of relief. Taylor is now pregnant, and so she has a little bit extra weight on her belly that is causing a little bit more weight down onto her feet. And so now she's wondering, the last question says, I was wondering how effective this would be for pain management and also overall improvement of the severe tightness and my quality of life. Because yesterday, we did work with her yesterday. She reported that she just couldn't even, there was pain going up and down stairs, pain with standing for long periods of times, and she does do standing for long periods of times. So to answer her question, yes, dry needling has been proven. Evidence has suggested that it does help with pain and increased range of motion. And range of motion is just that flexibility, being able to what we call dorsiflex and plantar flex that foot, okay? And there's much more to it. There's other things. We won't get into those. That was the question. So basically, does plantar fasciitis, can it be helped with dry needling? And what exercises can she do to help with it? So,
right. So we're going to show you a few general things today for foot pain. Again, we're not diagnosing what you have, but we're going to give you 3 things that we normally give to patients that help relieve stress in the foot to help take some of the pressure off that. So let's go over the anatomy before we show you the stretches. There's 2 parts to the calf. This is the soleus, which is the deeper of the 2 calf muscles that help us to push off when we're walking. Here is the gastroc. Let me pull back here so you can see it better. There's 2 heads to the gastroc. It's the big, pretty muscle that you see when somebody comes up on their toes. Now that we've looked at the anatomy, we're going to stretch those muscles. So the first muscle we're going to stretch is the gastroc, and the gastroc attaches behind the knee and at the foot. And when we stretch this, we want to make sure we keep the knee really straight. So Sarah, you're going to put your weight on the leg we're not stretching, this one in front, and we're going to keep this heel firmly in the ground, and then you're going to bend forward until you feel this knee start to bend or your heel lift. If one of those things happen, then that's as far as you can stretch. So once Sarah gets to that position, which she's at now, she's going to hold for 30 seconds, and then she's going to come out of that stretch a little bit. So shift back. Then again, you're going to move back forward. Don't let your knee bend, and keep that heel on the ground. And we're going to hold 30 more seconds. And she's going to come out of that stretch and then repeat it one more time. Now there's a muscle that lies deeper to that we talked about. It's the soleus. And the soleus doesn't cross the knee. So when we stretch that deep muscle, we're going to bend the knee on this one. So I'm going to have her shift her weight forward, keep the knee bent, but that heel has to stay flat on the ground. Can you feel that deeper, Sarah?
Yes.
It's a much different stretch. So you have to make sure that you're stretching the gastroc and its deeper friend, the soleus. So you're going to do that 30-second hold, come out of it, bend your knee, keep that heel flat. We're going to do that 3 times. Look here at this plantar fascia. It runs from the heel down to the base of the great toe. You can see where there's a strain. That area of pain that we normally see with plantar fasciitis is in pink. And it happens when we put stress on the toe. So we're going to stretch the plantar fascia on this next one. And you can use a belt, or if you have an exercise stretchy strap, something like that, or a gait belt, if you know what that is. But any kind of belt will do. So you're going to take the belt, loop it at the end, and place that belt over your big toe. And I'm going to have Sarah make sure that she keeps her knee straight. She brings her foot towards her nose, and then she's going to stretch that big toe. Where you'll feel this is going to be in the back of the calf, but also along the arch of the foot. You're going to hold that for 30 seconds and then relax out of the stretch. Again, make sure as you come back into the stretch, the knee stays straight, the toes are coming towards the nose, and we're pulling on that great toe. And we're going to hold 30 seconds, 3 reps. and that's going to stretch the plantar fascia.
Okay, so we just showed you 4 exercises that you can do if you have foot pain, or if you think you might have plantar fasciitis, or you've been diagnosed with plantar fasciitis. Again, we're not trying to diagnose this, we're just giving you some general exercises that you can do to work on those things. But we have something cool that we're going to try to do.
So we're wanting to do a study or an experiment on those of you that have been diagnosed with plantar fasciitis. So if you or someone that you know has a diagnosis of plantar fasciitis and you would like to be a part of our study and you're comfortable with dry needling.
Yes, because that is going to be part of our study. We're going to be looking at if dry needling does in fact work with those 3 or 4 exercises that we gave you.
Then please contact us, because we need 20 people to be a part of this study for us.
And the way you're going to contact us is through our wellpoint510@gmail.com. That's wellpoint510@gmail.com. Just send us an email, and we'll give you all the information regarding that. I'm kind of excited about this, something different.
Yes.
So it should be fun, and we would love to hear from you guys.
Yep.
Again, any questions as well. We love it when people ask us questions, because that gives us video and things that we know that is affecting a larger population and not just 1 or 2 people.
Definitely. So keep your questions coming, because we're nerds that way. We like this.
All right.
Y'all have a great day.
Bye.